and welcome back to a new session in our Know Your Medicine series. We sincerely hope that our previous videos have been useful and have added some information to your already existing knowledge. Today, we will focus on a new class of drugs. We'll look at some new aspects of diabetes, how it affects very different organs, how and why it is important to start treatment of diabetes once it is diagnosed, start the treatment immediately. And once the treatment is started, you have to stick to your treatment as per a doctor's instructions, follow all the instructions to ensure that not only your diabetes, your blood sugar is under control, under check, but also you protect your other organs, because diabetes is a disease that is a bit notorious in terms of its ability to affect and also damage major organs like the kidneys, the heart, the brain, the blood vessels, etc. So it's extremely important that you take your medicines and follow a strict diet and exercise regime as suggested by your doctor, so that you have adequate control, good control over your blood sugar levels. Now, talking about diabetes, we have spoken about how diabetes is a multifactorial disease. It has multiple steps, and that is why it also presents to the physician multiple steps to counter it, so that we can have different types of drugs that act at different levels. Today, we will be talking about a very important organ, kidneys, and especially in the elderly people. Kidneys are a very important organ because not only for the elderly people, for everyone, because the main function of our kidneys is to excrete or throw out those substances which are not required, those are in excess, or those substances that are harmful or toxic. The same also applies to sugar. Once we eat sugar, it does its function of providing energy, etc. It's absorbed in the blood and it goes to various organs, various cells, tissues, because it has to provide nutrition and energy to the entire body. Once that is done, it comes to the kidneys to be excreted, because whatever we eat or drink, everything has to, most of it, 95% of it has to go to the kidneys, and then it is thrown out through our urine. So sugar, once utilized by the body cells, and once its work is done, then it comes to the kidneys for excretion. But nature has given our body a tremendous mechanisms at various levels, at various organs, to keep our body at an optimal, normal level. So even in the kidneys, there is something called as a function of reabsorption, means something that pulls back. The kidneys pull back something into the body before it gets excreted. So sugar is also one of those substances that is reabsorbed from the kidneys. And this is done through a special protein, a special substance called as, it's a technical term, but we'll try to simplify it. It's called as SGLT2, which stands for sodium glucose transport protein 2. So we did not go into the detail, into the technicalities. So we just need to understand what is the function of this protein. So this is the protein that brings about the action in the kidneys of reabsorbing or pulling back the sugar. So now we can understand that if the body keeps on reabsorbing sugar inside the body, the kidneys keep on reabsorbing the sugar, what will happen? Slowly and steadily, sugar levels will keep rising in the body. And that is how, as you know, diabetes, the main feature of diabetes is consistently high levels of sugar in your blood. So if this happens, then there are chances that the blood levels, sugar levels in the blood keep on increasing, and they remain high consistently. So this caught the attention of researchers, of scientists, because they are looking at different mechanisms, because diabetes is one disease that is extensively researched. So they studied the mechanism, and they found that if we try to block or inhibit or reduce the action of this particular protein, then we can control the level of sugar that is rising in the body. And from there was born a new class of drugs called as gliflozins. They're called as gliflozin. They're a group of drugs, like in a family. You have a common family name, and then each family member has his or her own unique name, and then you add the family name. So similarly, gliflozins, and also for others, you must have heard of sitagliptin, those are called gliptins. You have bigonides, we saw that yesterday. Sorry, last time it was metformin. We saw sulfonylureas. So there are different groups of family of drugs. So gliflozin is a recent group of drug which caught the attention of researchers because of its unique mechanism, and thereby it also helps those patients whose kidney function is slightly deranged, not very severe disease. We'll come to that later. So this is how another treatment of diabetes was formed, and thereby protecting not only the kidneys but also helping the body to protect other organs from high levels of sugar, which could occur if you don't control your blood sugars adequately. So if you focus on the kidneys, majority patients of diabetes come to the physicians at a stage with some damage to the kidneys, and this is called as diabetic nephropathy. Now, when you go to a kidney specialist, he is known as or he or she is known as a nephrologist. Nephro means something pertaining to the kidney. Nephropathy, pathy means something abnormal. So diabetic nephropathy, abnormality of the kidney arising out of uncontrolled diabetes. So generally, it affects almost 1/3 of the patients, means 1 out of every 3 patients of diabetes will end up someday or the other with kidney disease. But this can be controlled if you are able to take care of your blood sugar level with adequate medication, good diet control, and good exercise regime. So this was about, in general, something about diabetes and some focused information on the kidneys. Why? Because the drug that we are going to discuss today acts primarily on the kidneys.